So the funding cuts are not just impacting these other countries. It's going to impact the U.S. because there's nobody looking across the borders to see who's coming over, who's got what, and how do we mitigate some of this.
Right.
And I'm not sure when the next pandemic comes, if it's going to be an outbreak of all these different viruses that nobody's getting vaccinated at the rates they need to. I don't know what it's going to be, but what will happen is you won't have a global response and a coordination between these countries to kind of mitigate the impact. Since America had the worst impact but the highest volume of vaccines, what's going to happen next round?
Right.
We're not a very sharing country anymore. Will we even have vaccines for ourselves since it's all about money? I'm not sure.
Welcome to the Know Your Rights Camp podcast. I'm your host, Amir, and I'm joined by our guest, Dr. Tracey Veal.
Thank you for having me today.
Thanks for joining us. Today, we're going to be discussing our healthcare system and what it means under the current administration for some of our most vulnerable communities. So could you start by sharing just some of your experience and background with us?
Sure. For the past 40 years, I've worked in healthcare, and I started out actually as an intern at the CDC. I lived in Atlanta, and I worked at the Department of Health Services, insurance companies. I pretty much got to see the entire system 360. And then I was relocated to California, and I studied pharmaceuticals. So I got the whole gamut of the whole system. And when the pandemic happened, people like me kind of stepped up to help support the interventions, because when I first saw the devastation of the pandemic, I think a person of color was dying every 5 minutes in Los Angeles County.
Wow.
And Los Angeles County had become the epicenter. So my heart was broken, and stepping in to help collaborate with the community and get people to trust in the vaccines and to try to help people during that time. It was a heavy lift, but we survived that. So I think we can survive anything after that.
Oh, no, absolutely.
Yeah.
I mean, we still have different trauma and different memories from it, and we're still shifting what they called it a pandemic to an endemic and just a different system, but we're slowly stepping out.
We're stepping out, but when you see the measles come back with virulence, and you see that Black people on TikTok are like, I'm not taking the vaccine, and you see the outbreaks, and you see that we're not people who get in front of the line when we have access to vaccines, you get worried.
Right.
Like, are we going to go back to that where Black people are dying at a higher rate than anyone else, and where the access to even the vaccines for people who wanted them was limited for a variety of reasons? And I just don't want to go back to that. That was tremendous.
Right. It does seem like in some ways our healthcare system is retreating, and our trust from it is also retreating. And historically, Black people specifically, because of the mistreatment, the medical apartheid, the experiments on Black bodies, whether it's the syphilis experiment or, gynecologists experimenting on Black women, there is some deep-seated mistrust. But I do feel like the pandemic kind of created this swelling that we still are dealing with now, and now things are rolling back.
Yeah, they are. The thing that was most compelling to me was having identified the physicians and clinicians and community health workers of color who went into these communities, because our lived experience was from those communities, and that helped engender trust. But if you eliminate those roles and eliminate the capacity for people to go and have medical school or community health workers of color, to me, you're really rolling it back, because who do you trust? Are you going to trust the current administration? Are you going to trust these guys who don't look like you that are telling you to go drink bleach? Are you going to do that sort of thing? Or are you going to trust people who come from your lived experience? So that's where I get a little concerned with what's going on right now with healthcare information.
Right. And the person at the head of some of these organizations, with the Health and Human Services Director, which I believe the CDC and other government entities with public health are under, Robert F. Kennedy has put out a lot of misinformation, anti-vax information. And I mean, like you mentioned, there are people dying of measles now, where this is something we thought we sort of addressed. But how does that affect the culture and just the overall general thing when you have a leader like that who subscribes to some of these beliefs?
Well, I think the first thing is, why is he doing what he's doing? He's a trust fund baby. He has money. But truly, when I saw some of the devastations that he brought into other countries where he did the anti-vax stuff, and people actually died in these countries, and they banned him from coming to these countries.
Really? Wow, I didn't know about
and
that.
And there's a very good video that talks about, it's a documentary, and who funded the documentary was the astrophysicist, Dr. Degrassi.
Really? Okay.
Because he was so upset that science was going the wrong way and it was impacting people of color. So for Robert F. Kennedy to get paid to go and do misinformation and disinformation in other countries and then be assigned to be the person who's heading up our most valuable asset in terms of health is terrifying. Other countries, I've gotten emails, text messages. They're like, is this real or is this fake?
There are now measles cases in at least 13 states, including Maryland, where a case was just confirmed in a resident who returned from international travel through Dulles International Airport earlier this week. The disease has already killed 2 people, including a 6-year-old child in Texas. These mark the first deaths from measles in the United States in a decade. Both were unvaccinated. It's important to note that according to the CDC, the vaccine to prevent measles is 97% effective. Instead of urging Americans to get vaccinated, the Secretary of Health and Human Services wrote in an op-ed for Fox News, quote, "The decision to vaccinate is a personal one."
Right now, we have we're delivering vitamin A. We are providing assistance if people need ambulance rides, and they're getting very, very good results. They report from budesonide, which is a steroid. It's a 30-year-old steroid. And clarithromycin, and also cod liver oil, which has high concentrations of vitamin A and vitamin D.
And the fact that it's real and there's money tied to misinformation, right. And we've validated that it's okay to do that and to do it to other countries, not just the U.S., is horrifying. Because now we're impacting, the whole world with what we've decided to do and who we've decided to appoint. So I find it terrifying, quite frankly, particularly since this individual has gotten the vaccines and so have his other cohorts, but you're telling other people not to get them, and you're telling them to drink cod liver oil for measles. There's people that are giving that out in Texas and these other states now that are impacted by the measles. So it's kind of scary to me, and people are drinking it and kids' livers are impacted, and then they're going to the ER for different reasons. Yeah. So to me, the fact that we validated that it's okay to do this kind of stuff, particularly to poorer communities, and once the measles hits the vulnerable communities, who's going to be there now that you've cut a lot of the staffing and support for those underserved communities? So I'm terrified, quite frankly.
No, it was terrifying watching his Senate confirmation hearing. There was a black legislator, I don't remember who at the moment, but they were asking him about some of his things he said publicly about basically black people. There's always been this notion that black people feel less pain. Yes. And have this supernatural thing. And he blatantly said that. So it was very terrifying and almost dystopian that this is the person who's now in charge of our public healthcare system.
I have you were on a show on February 26, 2021, an interview with Dr. Judy Mikovits, where you said the following, and I quote, "We should not be giving black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Poland article suggests that blacks need fewer antigens than...
This is so dangerous.
So you get the same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
And we did a lot of work to kind of eradicate some of these myths. We've spent a lot of time spending time with the clinicians and the doctors of the future and the current doctors to explain to them, no, Black women feel pain just like everybody else,
Right.
and giving them a lot more information and education about that. Now that's being taken away. So it's funny to see that he's saying all of this, which is what we tried to eradicate when we did the pandemic and saw that there are people who really believe this, and to have them have people who came to them with lived experience that eliminated them having that distrust. Now we're back to that.
Right.
So I think it's frightening for all of us who are in the healthcare system and all of us who have to utilize it, because you're going to get these folks who believe that and will not give you pain medication or whatever you need. So I think it's very disheartening.
Very. And America's in a unique place as a first world country, the most developed country, the most rich country. But I know people who go north to Canada or south to Mexico for basic medication or procedures.
Yes.
You know, people who fly to Europe to get dental procedures done and different things. So what are some of the issues or barriers in our system, healthcare system as a whole, that leads to it being this way?
Well, one of them is you have a medical deserts. Really, there's
Medical
places
deserts.
and counties where there is no physician, clinician, nurse practitioner, doula, anyone.
Wow.
And I was recently in Atlanta, and they have 150-something counties. And of those, 70% probably won't have anyone to give care, because why would you want to practice when the government is there in the room with you telling you what you can and can't do, and that it's okay to have a woman bleed out in a parking lot or, you know, in an elevator because you're not comfortable, that your license will be revoked if you choose to do a much-needed procedure that has now been told it's illegal in a lot of these states. So who wants to go practice in these communities? So access to care, on average in the rural communities, people are driving 40 to 50 miles now. Maternity wards have been shut down. A lot of rural hospitals have been shut down. So where do you go for care? And at the rate we're going, a lot of the funding for federally qualified health centers and things that the government supported in these communities, they're being eliminated. So where will people go to care? They'll go to the nearest emergency room.
Right.
And where is that? It doesn't matter where it is, they're going to get there.
Yeah.
So to me, that's not the best way to approach care, particularly because of the Obamacare and Accountable Care Act. We got so much more support to provide preventive care at no cost or low cost.
Right.
And people really engaged in that. More people were covered during that time than any other time in the history of America. So to see this roll back like that, and we can't afford it. We
Right.
can't afford it as a nation. We can't afford it as a global economy. So can people really afford to fly? Or I know people who drive to Mexico to get their care because they're uninsured and don't have care, or because they work and they don't have coverage. So to me, we're going back to that when we had
Right.
done such a great job of changing the curve, increasing the lifespan of people, and being more equitable about how we approach healthcare resources.
Yeah, the rollbacks of prevention is specifically troubling because we know it saves money, right?
Right.
It's cheaper to prevent diabetes by eating healthy and exercising. It's cheaper to prevent cavities, you know, by brushing your teeth and different things. So we know that prevention actually saves billions, but with our privatized healthcare industry and the, you know, pharmaceutical industries and different things profiting billions off it, that's sort of why we see them rolling back policies that prioritize corporations over wellness.
Right, all about money. But the one thing that I recall significantly during the pandemic was that people couldn't think about vaccines because they had the basic needs they needed to deal with. So instead of just focusing on we need to get people's health care addressed, we needed to deal with what we call the social determinants of health, all those other things. You can't pay your light bill, you can't pay your rent. You needed to deal with that first. And we did a lot on food insecurity. And to see that roll back because there's not going to be coverage for some of those programs. And the fact that for competitive reasons, a lot of the health plans decided we need to jump into that and we need to help support people when they're discharged getting a meal, or people who don't have food because they're going to end up in the hospital. You're going to pay more. So to see coverage changes that were significant to support some of the social needs, whether it was transportation or food insecurity, or even, you know, having somebody to come and they give a caregiver a respite care so they could actually breathe for a minute, since caregivers tend to have higher death rates than the people they're caring for at times.
Really? Wow.
Because the burden
Right.
is there and they don't get compensated. So to see a lot of that changing right now is It's a hard shift, so I think people need to rise up, raise hell, and do something about it. Otherwise, we're going to go backwards even further than we were during the pandemic.
Right. And during the pandemic, there was an interesting phenomena happening where life expectancy, especially for Black people, actually started declining for the first time in documented history. This is something that's been tracked for over 100 years. And to see it go backwards was very troubling. And so what now with the other cuts and reforms and rollbacks, do you think it'll have a similar impact on life expectancy and outcomes and health outcomes?
I think it will if we let it. I think what I saw growing up in Atlanta during the civil rights movement, it's up to us. So people coming together, and I live in Pasadena and Altadena where the fires were. And what's happening is as soon as the government opportunities weren't there, people jumped in to help. Now, does that mean it absolves the government of having to support it and they're doing certain things? Absolutely not. But what I see is it's up to us. So we need to come together and figure out what are we going to do. Just like during the civil rights movement, we had souls to the polls on Sundays. We figured out find a way or make a way. We need to take the same approach because it's up to us. Nobody is going to save us.
Right.
So that's the way I see it, is there should be a convening and collaboration amongst all the people who do this work. Since at this point in time, we don't know who's going to keep their jobs or not that are working in healthcare in the government. We've seen total elimination of a lot of jobs, and it's not even stopped yet.
Right.
So in the healthcare arena, you have people who are going to medical school who are trying to do the right thing for the right reason. And I think we need to capitalize like we did during the pandemic. Most of the immunizations and interventions we did were with community organizations collaborating with the physicians and the clinicians and community health workers and the churches. We need to do the same thing to deal with this. It's not going to solve it all, but I remember when I was young and there were Black and white hospitals and the fire department and people who were in that community helped give blood pressures when we couldn't get into the hospitals. So we need to take the same approach, act as if it's the same era, and do the right thing for the right reason.
Yeah, unfortunately, it is looking familiar like that era. And health has always been a part of the civil rights movement. I recently learned that many breakthroughs and reforms in health came from the Black community supporting themselves, like even the ambulance system, emergency response, our free food program. The Black Panther Party started things like that. So it started with our own communities. And sometimes the church would be that place where different things would happen, the supports, whether it's the clinics and, pop-up screenings for health or different things still happen at the church today.
Yeah, so the pop-up screenings need to go back because people are going to we're losing a lot of funding to support. So how do you do that? We got to find a way or make a way. So I think it's really important for people to understand that it doesn't just impact a low-income person. It's going to impact everyone. And what I think people don't get the bigger picture is that every time a person who is low income goes into that emergency room, doesn't have the funding, your tax dollars at work. Is that the way you want to spend your tax dollars? Right. So the preventive care and all these other things that we need to re-engage in and not focus on, when people go to the hospital and the readmissions and all those things that happen. We need to do the upfront. And it is really up to us to do something about it.
Yeah, something has to change.
Yeah.
And 2025 has been an eventful year for not just healthcare policy reform, but just systems changing and transforming. Lots of proposals on the table, some being voted on right now that, remove billions of dollars from systems. What do you think have been or will be some of the most impactful changes that are being proposed to our healthcare system?
One of the ones that's probably very troubling to me is the Medicaid one. In California, they call it Medi-Cal, but the Medicaid one, because 4 out of 10 babies, 40% of the babies in America are born through Medicaid.
Wow.
In addition to that, for nursing homes and long-term care, a lot of that is Medicaid. And the Medicaid program is 50-50. It means the federal pays half, the state pays half. If the federal says we're cutting it off, that leaves the states to pick up all of that. The states cannot do that. They won't do that. Right. So that means a lot of people who are entitled to those programs will lose that. In addition to that, there's a lot of rollback on funding for even payments. So who will get paid to care for these folks? So there's a lot of question marks on what's the impact of that. that means a whole lot of people aren't going to get care. That means we have a whole lot of sick people, right? And then when you think about it, think about something like measles that, we had to get these vaccines to go to school. A measles shot protects 18 people from that one person who will spread it. COVID doesn't even have a third of that many people infected. A lot of people get those shots through programs that are funded from Medicaid.
Right. I
or
think that's
from
how I
free
remember
clinic.
getting my shot, actually,
Yeah,
as a
you
kid.
got it as a kid, and now those programs may go away. So this infection rate and all these things that are happening for those who need it, who want it. If you have a compromised system, if you have diabetes, it's going to be worse on your system. So do we really want to spread these things? Tuberculosis is back. Some people are saying polio is probably going to come back to America because we don't have border health security the way we had it with the World Health Organization and other entities. So no one is going to check who's coming in, who's coming out, and where is it coming from. There won't be somebody checking for Ebola or whatever it is. So that's a little terrifying. So Medicaid helps fund a lot of these programs where people who are underinsured, they work, they can't afford insurance, or they are immigrants that don't have insurance. A lot of that funding came from Medicaid. And when that goes, God help us.
Yeah.
Yeah.
No, and Medicare as well, right? I think I have the statistic here.
Oh, yeah.
According to studies, about 40% of African Americans, 53% of Latinos are on Medicare Advantage. And that's another area that's with proposed funding cuts.
Yeah, Medicare Advantage, the out-of-pocket costs are a lot less if you had straight Medicare. So it was a smart move for people of color to get on those programs because a lot of the extra benefits they get, whether it's food support or no out-of-pocket costs for certain medications, really help people to preserve their quality of life. So they don't have to worry about paying all this out-of-pocket. They don't have to decide between my medications or my food. Some of these plans provide both and over-the-counter support. So to me, if that's eliminated or reduced significantly, people won't be on those programs, right? So that means they have more out-of-pocket costs, more sickness, more chronic disease waiting until you absolutely get sick. If you think about it, I know South LA is one of those areas in California. If you think about it, there's the trauma center is 40 minutes away. A person could die of a heart attack trying to get there, right? In an ambulance even. So you think about what does this mean? This means there's a lot of cuts to systems that support underserved communities as well as regular people. When you think about a lot of these areas in different states, it's not just poor people.
Right.
It will impact all of us.
And there's things happening at a global scale, too, that are largely impacted by what's happening here. For example, with the proposal to withdraw from the World Health Organization. And I believe the United States is the biggest donor, supporting, initiatives and preparing for pandemics like COVID and different things like that. What kind of impact do you think that would have both locally here, nationally, and internationally? Well,
one of the programs that is really impacted is HIV. And the number one population of people that have HIV are Black people. And first there's Black men, and then there's Black women, and then there's Hispanics. So you think about those kind of programs that were supported on a global scale. And over 500,000 people without those programs will have HIV, and over 600,000 will die globally.
Wow.
And
Over
so when you
500,000
think
people
about the
die.
sheer numbers where the reductions, you're like, oh, it's not that bad. Oh, it's that bad. And to come to work one day doing this type of work and just be told to leave is not a good look. There's no preemptive planning on the impact, not just to the U.S., but globally. And as you know, we're all interconnected.
Right.
When somebody gets a sneeze in one country, just like COVID, it crosses the borders. Just like measles. Some countries are really angry at us right now.
Right.
Watching the measles outbreaks go across the border to Mexico, and then it's probably going to go to other countries.
Right.
So that's where World Health Organization, if you think about the pandemic, the recipe for the vaccine was shared around the world to figure out how do we make this? How do we get it to everybody? That's the first time that's happened.
Wow.
And you have organizations like World Health Organizations that look globally for how does this impact everyone. So the funding cuts are not just impacting these other countries. It's going to impact the U.S. because there's nobody looking across the borders to see who's coming over, who's got what, and how do we mitigate some of this.
Right.
And I'm not sure when the next pandemic comes, if it's going to be an outbreak of all these different viruses that nobody's getting vaccinated at the
Right.
rates they need to. I don't know what it's going to be, But what will happen is you won't have a global response and a coordination between these countries to kind of mitigate the impact. Since America had the worst impact but the highest volume of vaccines, what's going to happen next round?
Right.
We're not a very sharing country anymore. Will we even have vaccines for ourselves since it's all about money? I'm not sure.
Right. Yeah, there's an increased isolation happening with the U.S., and it's not just the World Health Organization funds, but I believe already the administration ordered the CDC, the Center for Disease Control, the FDA, Food Drug Administration, the National Institute for Health, and others to pause all external communications with that World Health Organization. So information sharing, research sharing that could actually help save lives and coordinate a better response to different things. So it almost seems like there's a deliberate attempt to create a dysfunctional system where there's no connection, no coordination, and if a pandemic comes again, it'll spread even more so.
Yeah, I think that's kind of a really interesting point, because if you look on the websites have eliminated a lot of this information.
Wow.
And as a result of the pandemic, there was a pandemic playbook that was created. So anybody could click that box around the world and we could all coordinate, here's what we need to do. Well, all of that information is no longer available, right? So what happens if we do have a crisis, whether it's any type of crisis? And you think about what happens with global support. When we had the fires, there were people who flew in here from other countries to help, right? When we had the pandemic, there was a lot of global support around the world to kind of coordinate. That won't happen anymore. Even when we had 9/11, there were people who came from other countries to help. So we're asking for trouble because we can't do it alone as a country. We're not the largest country in the world. So there are other countries that have resources and support. And to see these countries come together that used to not even talk to each other because of what the U.S. is doing, on the one hand, it's a plus. On the other hand, it's a minus. Because when we have the need, I'm not sure if there's some big earthquake or whatever that people are going to fly over and help us. Right? Since we pulled all of the resources to help other countries with that recently, with USAID.
With USAID, and as you mentioned, over 600,000 people estimated to die from what is preventable from literally just sustaining the previous funding. But instead, you're seeing tax cuts for the wealthy that literally could fund all of this 10 times over. You're seeing all sorts of stuff to dismantle the system.
Well, that and the fact that if groceries are going up so high and people had any type of vouchers or programs that they could go buy, they're going to have less money to use. They're going to make decisions that may not be the most healthy choices because that's what's cheaper. And so you'll see an exacerbation of people getting sicker because there's so much stress right now with everything that's happening on top of prices going up, that people tend to get more stress. Mental health tends to go sideways, and then there's not support for that. When I saw there may be elimination of the hotlines for people who need help for mental health, it's a scary thought because those are lifelines for a lot of people. So we're asking for something that I don't think we fully have projected what we're going to get from it, but we conceded it would be catastrophic. So like I said, it's up to us to find a way or make a way.
Right, to make a way.
Yeah.
And we talked about it earlier, but this country has a long history of medical racism, medical apartheid. I mean, I've heard some scholars say that even the privatization and current status of our healthcare system, our health insurance system, is in part because some Southern legislators didn't want Black people to have access to healthcare. So there's still this distrust in Black communities specifically, but in others as well. What are some of the things that went into this, and how can we address it to overcome it?
I think the way people who have short-term focus are looking at it is we need to cut costs. But they're not looking at the implications of cutting the cost the way they're going about it. Imagine going to work, your key card doesn't work, and you just lost your job. You had no planning, right? Your insurance may go that same day depending on who and where you work, right? If
scary.
you did have insurance. And what if you were signed up? What if you were one of those USAID people who was pregnant over in another country? You got that notice. You're stuck over there. So to me, it's like the planning is not part of it. Nobody's even arguing that we need to be more efficient in government, but to go about it this way, particularly when one of the things you said was that the insurance industry, we got more people into insurance than ever in the history of America. Now you're going to wipe that away. So where are they going to go, right? And what is going to happen? Well, what was happening? Why did we even implement these things? So I think the short-term view and the fact that a lot of people are complicit in this happening, but it's going to hurt everyone.
Right.
You know what I mean? It's going to hurt everyone. So you can't say it's just the low-income people. No, it's going to hurt everyone. And the fact that you had to have, you got insurance from your employer mainly. And if you work for an employer that didn't offer you that, you are already at risk. And who worked those jobs, sub-minimum wage or jobs that didn't have insurance? Mostly people of color, right? So you're going to go back to that, where at least you had the Accountable Care Act that allowed people who didn't have insurance to have funding from other sources to help support that. And now that's going to may go away altogether. And the fact that people don't understand that it is not just low-income people. We will all be impacted, just like tariffs and prices. The medication you get, some of those components are made overseas.
Right.
And the supply chain and how even a refrigerator part may come from another country. So having healthy food, being able to have health care, all of these things will be adversely impacted by these changes, and no one's thinking about that because they're so wealthy. They're like, whatever, we're cutting costs.
Right. And I mean, some of it's cutting costs. I think some of it is just dismantling systems. So like the SNAP program and EBT, right?
Yeah.
It's really just a small fraction of the budget, right? With this country spending over 40% on its military, you know, less than 2% on social and welfare programs like that. And it's not just SNAP, you know, in the food programs, but then you can look at environmental agencies and the regulations that's going to impact our water quality and our air quality and other things that also impact health. So it's like a perfect storm of, you know, less access to food for some families, less access to a better environment, which also impacts your health, and then less access to health care.
Yeah, I think the other thing is regulating some of this. Like if you see how freeways and where people of color live close to the freeways and all the environmental pollution and less trees that kind of take some of the junk out of the air.
Oh, yeah. No, I have a lot of friends who have asthma specifically because of where they grew up.
live.
You can see the clusters,
Yeah.
you know, based off location to the freeways or even different buildings and government housing where they had asbestos and different things in these
And
conditions,
lead.
lead, the lights and different things that impacted students' test scores and ability to focus and stand still in school. It all came from these environmental things that, you know, our government kind of supported.
So if you eliminate the education department, the FDA, and all these other, you really reduce those, and the Environmental Protection Agency, who's going to watch? Who's going to look? At least there's some retribution from people about it. Now it's like, who's going to oversee that?
Right.
Who's going to care about the impact of lead on, you know, people of color? And even with the fires, looking at the testing that's been done around lead and the fact that that's eliminated. Now, who's going to do that work? Will nobody do that work? And people will go back into some of these environments where they will be poisoned from things that they didn't know. Or even soil testing. Who's going to do that work?
Exactly.
Not needed, just rebuild. You know, it's not quite that simple. So I think that, to me, is where some of the trauma for people is happening, where the worry about, is this safe and who's going to safeguard it? Who's going to safeguard it? Like I said, it's now going to be up to us. And are we the experts and scientists? And one thing I will say about scientists, the National Institutes of Health, a lot of the disparities for people of color, particularly when it came to medications like, say I take high blood pressure medicine. This medicine wasn't necessarily tested on black folks. So they have National Institutes of Health would do some of the interventions where they would test these medications to see if it's the right thing for a person of color or a woman or different populations. To see that go away is even more concerning because we had gotten to a place that the advocacy to make sure we included, you know, people of color in these clinical trials and gave them a voice at the table about what worked for them and what didn't. To see that go away is even more terrifying because we'll go back to, you might take something that may not be suitable for your, you know, ancestry, and that could, you know, be a really bad thing for your health.
And you mentioned social determinants of health earlier, and we talked about some of the environmental stuff, but you know, studies have also confirmed that racism is a determinant of health. The lower outcomes for black people isn't because of biologically we have some deficiencies that make our life expectancy. Last time I looked, I think the life expectancy of Black people was about 10 years lower than white people in this country. Can you talk more about the racial determinants of health and how that?
Yeah, some of the racial determinants are things like redlining, where you could only live in a certain area. And I bring this up because when we look at a city like Altadena, that is the only place a Black person could get a house, could buy a house. And that made a difference to people's lives. And there was a legacy of people having a house and being able to pass it down. And that wasn't common. And they had some of the highest home ownership rates. But people were pretty much segregated to certain places and spaces. And those may have been next to a Superfund site. So Black people's health and people of color's health was already impacted by having to go to these particular places and spaces in order to live.
Wow.
So that alone has a legacy of its own over the course of history, and it continues today. And when I looked at California, I was surprised to see so many Superfund sites people don't even know about. But who do you think is living close to those?
Right.
So to me, it's like you really need to think about getting this information out to people like you're doing today, and take a look before you go and work somewhere or buy somewhere or rent somewhere, what the environmental situation is, so that you know what you're up against with cancer and other things.
Yeah, and speaking of cancer, another thing specifically impacting the Black community, and specifically Black women, that has come from, in part, from neglect of oversight from our government, which again is rolling back, so there'll be even less of it. But there are more and more studies, more and more lawsuits confirming that, different hair products that are toxic with formaldehyde and create uterine cancer and breast cancer. And my mom actually had uterine cancer, and I believe it was probably related to this. But what can we do about things like this, right? Where if the government is failing, the federal government, because I believe some states like California, Maryland, and others have passed protections and regulations to oversee these things. But what can we do to protect ourselves if the government isn't going to ensure that certain products that are literally toxic and poison are not regulated?
Yeah, it used to be the role of public health to disseminate information, but what I find now is most people get their information from social media or
TikTok,
friends and from TikTok and all these other things, or Black Twitter or whatever.
Yeah.
So to me, it's like full court press with cosmetologists and other people getting that information from those sources, particularly when you think about a chemical relaxer with formaldehyde in it. That's what we use to embalm bodies and different things. Wow. But it's in your head. It's in your hair. Who knew, right? So there's a movement to have warning labels, just like we do on cigarettes, to tell people, because you think if we knew that. I remember during the 80s and 70s, I was one of those people perming my hair. It was already straight, but it wasn't straight enough.
I had a Jerry curl back in the 90s,
So we were like, we didn't know what we didn't know. So I think having convenings of Black folks and other people of interest to put that information out there, I don't think people know that hair weave that you got might have a whole lot of lead in it.
Yes, even the weave.
Yeah, even the extension. So there's no warning labels. There's no information. So it's up to us. So it's like we get so much information out on social media. This is the kind of thing that should be a worldwide thing, because it's not just our brothers and sisters in America. It's all over the world, particularly in African countries and other countries where even skin products
the bleaching thing,
the bleaching
really
thing is big. So we need to get it out there. And to me, it's like I said, it's really up to us. How do we collaborate now on a global scale? You got to use social media. And you may not use social media in a traditional way, but that's the only way a lot of people are finding out about these products and these lawsuits and the uterine cancer and the fibroids and all these other things that are maybe a result of all these, cancerous and carcinogens that we're seeing in these products that who knew? And people have been using them for years. Even talcum powder. I know it was a common thing Black women use. Who knew that could cause cancer?
Yeah.
And this information isn't out there. And I say is, where do you get your information from? Trusted people, or not just social media, but the churches and other people really need to have kind of a health collaboration. We need to be our own World Health Organization amongst ourselves to disseminate the information.
Right, and I've seen initiatives with Black scientists who do the test. I mean, I think that's how some of this information came out, because the government wasn't regulating and testing it, but different scholars started to test these chemicals and see how toxic they were, and now you're seeing more and more lawsuits. But I mean, tens of thousands of Black women have been impacted over generations. And I mean, even Black men, I think of the Malcolm X book and movie where they show him doing the conch, right? And
Burning his
burning
head.
his hair and they're
Yeah.
screaming,
And it did burn.
Yeah, it's poison. That's why it burns. Anything that feels like that, that's your body reacting, trying to tell you that it's not what should be on your or in your body. So.
In your body or in your head. But who knew, right? No one knew. So now that we do know, and people are going natural or just not perming or whatever, I can't even remember the last decade I had a perm, but you just kind of learn and you do.
Right.
And it's like each one teach one. I remember the barbershop and the beauty shop initiatives where we did health screenings and things like that. We almost need to get back to that.
Oh, absolutely.
And, you know, because otherwise, where do you get your information from, right? But who's going to do that? Because now there was funding to do that. We had grants from the National Institutes of Health and other organizations. Now those don't exist, so it's really up to us. How do we repurpose some of the funding that we use for all kinds of other things, you know?
Right.
I know it costs a couple thousand tickets to go to a concert.
Right.
You know, maybe there is some money that we all allocate to help support some of this.
Right. That's what it's going to take.
Yeah.
Thinking of moving forward as we wrap things up, there's a lot of misinformation, increasingly polarized views out there, whether it's coming from TikTok or different things. It's almost like a gift and a curse because you can find out something you never knew, but you can also find out something that was never true, right? What's some resources or websites or a place where folks can go maybe to find some information out there, some credible information?
Incredible. And the number one that I utilize is blackdoctor.org, and it's because it's for us, by us, and with us, meaning the evidence-based information is targeted specifically to issues that we care about. Like you mentioned, hair products. There's a lot of information about fibroids, prostate cancer, all kinds of healthcare conditions, and preventive medicine. And there's stories about real people who went through certain things, you know. So it's like live and in person. And then there's a lot of seminars and webinars and other links to other information. So I think that's a valid one. The other thing I would say, if you can get your hands on Black newspapers. I know in LA County we have the Sentinel and other communities, because it's like, who do you trust? You better trust people who have your interest in mind. In addition to that, some reputable academic institutions.
Right.
If you want to look at historically Black colleges and university, Morehouse School of Medicine, some of them have, and even Charles Drew University of Medicine. I trust those folks and those physicians and clinicians and community health workers more than I trust others. So I tend to look at the information that comes from their sites more than I would trust some of the others, because it's about us and for us and by us. So that's what I would suggest to people. And if you are on some of the social media, there are credentialed physicians and nurses and other people who are giving information. You just have to be careful and make sure they're not going the other way.
Right.
But there are people who folks follow that provide credible information that I can give you after this.
Awesome. Thanks for that, Dr. Veal. Thank you for the work you do. Thanks for joining us today.
Sure. Thank you for having me. I just hope that it makes a difference in the lives of the people we care about. That's the most important thing. So thank you.
Absolutely. Thank you for tuning in to the Know Your Rights Camp podcast. Be sure to follow us on social media at Your Rights Camp, and also check us out on YouTube at Know Your Rights Camp.